The Department of Education is offering training to all of its staff on the procedures which are now in place to handle sick students. And the Department of Public Health is also continuing its community outreach. Public Health Director Peter Roberto says education is key in preventing the spread of the virus, and parents are being advised of what to look for when their children get sick.
With parents, we talk about fast breathing or trouble breathing, bluish or gray skin color, not drinking enough fluids because all of a sudden they're just not feeling thirsty, severe persistent vomiting, not waking up, or not interacting because, normally when you're feverish, you don't feel very interactive at that time. Typical for children, children really love to play, and then all of a sudden you notice they're not playing much anymore, and being so irritable that the child does not want to be held. So these are just some of the symptoms that we want to make sure that parents are aware, because
Roberto says that symptoms differ with each child, and parents should really see a doctor if their children get sick. At the Department of Education, they're geared up with necessary hand sanitizers and new procedures which will quickly isolate sick children if they go to school, and they're asking parents to keep their kids home if they are ill. Meanwhile, Public Health says it is well stocked with antivirals such as Tamiflu and the testing kits, which are distributed to various clinics.
Right now, the testing kits is being administered to those, and there has been a clinical advisory that, it's a known fact amongst the physician that the testing kits is a medical, tool, 50 to 70% accuracy, and the doctors will have to decide whether they're going to go ahead and administer the swab. We know that the flu is here already. It's here in our community. So what we want to do right now is ensure that the treatment course is being followed. And that treatment course, we now use the antivirals, which is the Tamiflu or the Relenza.
Do you have enough of that too?
There's adequate supply in our pharmacies, and our stockpile has not been touched.
There have been 61 confirmed cases of the H1N1 virus on Guam and 1 death. And Public Health is awaiting additional test results, although they are not reporting how many more suspected cases there are. Outside of the 61,
sure.
Are there more that Public Health is?
We expect that. In fact, when we do get their lab results back, and it could be anytime when we do get the results, and as we do, and as we have done, and we will continue to do, Mana, I will report it out.